Zimbabwe has been in general economic decline for the past 2 decades. GDP has sharply fallen. Unemployment is at an all-time high, and the standard of living is not what it once was. In the midst of such difficulty, a deadly global pandemic did not spare Zimbabwe. As of November 2021, 3 waves of the COVID-19 pandemic have swept through the country, claiming over 4,500 lives and tallying over 133,000 infections. In an attempt to prevent mass casualties, the government of Zimbabwe followed the global trend and instituted a hard lockdown. Borders were shut, as were all non-essential activities.
The freedoms we have always enjoyed and had grown accustomed to. From now on, these freedoms stand suspended. All non-working sections of our population will be required to stay at home.
The lockdowns affected people of varying income levels. Livelihoods were upended overnight.
Pakaita lockdown yakaitika I think pasi rese. Still vanhu vataita senge indaita zve cross border. Tasabvumidzwa kucrossa because of COVID-19. Saka zvinhu zvekuti takatanga kurarama kwacho kwanga kwakunetsa tange tisisina mari yekuti chengete mhuri kumba.
Sunday toziva kuti Thursday, Friday, Saturday handitase handishaye mari yekuti ase yekuraramisa mhuri yangu nekuzviramisa pache zvangu. But pakazongonzi COVID yaita se yatanga zvezvo zvaita zvaenda namudondo wakuswera uri mudheni uchidongorera hapana zvakazombobuda. Ndo mafetera yaita as an artist.
It was very hard for us economically because we are students. We did not work in foodstuffs. Actually, it was really hectic together.
The lockdowns were absolute, and this affected everyone in some way. While most schools were shut down, those that remained open were forced to adhere to the curfew times, severely affecting learning.
Ini ndaenda unoita course yangu pa St. Peter's kubatana, but aitanga na 8 topedza na 4 to 5, but pakazotanga curfew tanotanga kunzipedza ina 3 or chichichi saka zvezvo zvinotanisa zokwanisa kunyatsobatana kuti tikwanise kuti zvinhu zvipinde mumusoro nekuti nguva yedu yanga iri diki.
The government put in place measures to mitigate the effects of the lockdown on the general public. Unfortunately, not everyone who needed the assistance was able to receive it.
During that period, there was nothing. I mean, business was terrible. There was no assistance in any way. It basically was just survival mode. How best are we going to get through this, with the non-existent help that we were getting?
In March 2021, the government approved 4 vaccines for immediate release to citizens. These were Sinopharm, Sinovac, Covax, and Sputnik 5. 1 million doses were acquired by the end of the month, comprised of donated and purchased doses. Doses were distributed to medical facilities in all areas, from low to high-density suburbs. But despite a sustained media campaign, uptake was initially very slow. As with any new initiative, there was hesitation, which was more pronounced in lower-income areas.
Pane zvinhu zvaicirculata masocial media zvakadraw attention yangu like vamwe vairwara, and then ndakasangana neimwe scenario yekuti ndakakwira public transport ndikanzwa vamwe mai vaitochema vachiti hanzvadzi yavo yabva kushayikwa nekuda kwekunge anga abayiwa.
There are bigger churches with bigger followers. Zvinoita ndezvekuti ma-leaders avo anenge achivaudza kuti it's the mark of the beast, ukabayiwa unozofa, kana kuti hapanozova nekuti unenge uchitoconvertwa into Satanism. Those are the things zvekuti ma-followers haakwanisi kuti azobayiwa anenge achitya.
While uptake was not 100% in higher income areas, the belief in widespread misconceptions of the vaccines was considerably lower.
Everybody has a theory about something or the other. A lot of people just tend to be more skeptical when it comes to medicine in particular, or the science behind it. Okay, so we tend to, look down on something that we don't fully understand, and more open to believing the impossible or unlikely.
With the reality on the ground, you start to think that better to be alive than to put up with these conspiracies. I've got kids to think about. So yeah, rather be alive and look after my kids than be dead and leave my kids. Yeah.
While the government did well to bring the vaccines in, various logistical issues have stymied progress. The need for 2 doses for full vaccination, for instance, has left many scrambling for unavailable vaccines. Brezhnev, a resident of Highfields, a high-density suburb of Harare, has had trouble finding a second dose of the Sputnik 5 vaccine, even as he traveled across the country.
Any center parubaiwa vanhu ukangovhunza jebhu rawinaro unogona kubaiwa the second one. Madhesi angu akakwana ndiri kumaNicaland. Ndiri kungovhunza naye mungatiwo Sputnik zvikanzi aiwa tine Sinovac. Naye mungatiwo Sputnik aiwa tine Sinopharm. But now I'm very well. I'm very fit and strong, but andisandabaiwa second jab. That is the point.
Long queues for the vaccine were most prevalent at government institutions.
Inini andisati ndavaccinatwa nechikonzero chekuti pandiri kuenda ikoko kunovaccinatwa ndiri kuona kuine maqueues akawanda ende pamwe pacho ndiri kunzwa kuti rimwe jekiseni harisati rauya rimwe richazouya here saka ipapo ndo pandiri kuzondiconfuse manje kuti ndizive kuti racho randiri kuzobaiwa iroro rimwe racho ndichazoriwana rini kana kuti ndichazoriwana nguwai nemhaka yekuti pari kunzi pari kudiwa 2 mavaccination unofanira kutanga wabaiwa rekutanga wobaiwa rechipiri saka pari kuniconfuse ndevekuti ndikazobaiwa rekutanga rimwe racho rechitu rikazoshayika chii chichazenge chichizoitika kwandiri.
As a result of the long waiting periods, people began to lose patience as time spent waiting was time they could have been making money, which is especially crucial in a highly informalized economy such as Zimbabwe.
If there would be a way for them to reduce, the time so that people can spend not more than 30 minutes and then, focus on being productive for themselves and for their families, it would be more welcome because you then see others actually walking out impatiently, as calls come through for various deals, and opportunities to make money. People then just give up. And then, it's very difficult for them to actually then come back again to try and get the vaccine.
In contrast, however, those with the means to pay for the vaccine had no issues at all with long waits.
I was vaccinated at Baines Hospital and it wasn't hard, it was easy. There was no line. We just went to the reception and paid $2 for the vaccine.
Beatrice, a self-employed woman in Mount Pleasant, succeeded in getting her first dose at a government clinic, but subsequently had problems going back for her second dose.
For the second dose now, I ended up going to a private facility and I had to pay $5 because I didn't want to be standing in the long queues. I just wanted convenience basically. And also because all that, like every time you'd go to the local clinic, you'd be told, I got Sinovac. Then the second dose, all I could find was Sinopharm.
In other areas, however, they are happy with the level of vaccination and are reporting no more queues, further highlighting the challenges authorities are facing in distributing the vaccines equitably.
Hakuisina maqueue nekuti vanhu vakavaccinate. Ma-1 ari kutowanika ndivanhu vakasarira vanga vari kune mama areas vanenge vavisita and stuff, but otherwise the record yatinayo ndekuti vanhu vakavaccinatwa vanoenderana nemanumbers ari muward.
In mid-2021, the government of Zimbabwe instituted a vaccine mandate that forced all government workers to get vaccinated or lose their income. Vaccine uptake increased slightly among civil servants, but awareness programs still face challenges from the rumor mill.
Those were 2 days. After daytime,
If government were to ease access to vaccines, as Silas points out, more people would be willing to get the vaccine.
Kana kuri kunzi vaccination iriko ngaivepo ine majekiseni ayo ose ekuti ndikabaiwa rekutanga rechipiri racho risazondinetsa kunge ndichiwana zvinoita kuti ndibva ndanyasonzwa kuti ndikuda kuvaccinatwa.
Dr. Mugamu also has an opinion on the lagging vaccination rates.
I'm not too sure whether people now take it seriously. Because yes, there are people who are dying and possibly dying quietly without having gone through the test. There is a perception in this country, in my view, that for people to take you seriously, we must record the death of an important person. who carries publicity with him. So in the absence of that, we have problems.
With all the challenges that COVID-19 has brought upon the country, people are anxious to get back to some semblance of normality. For some, the economic reasons take precedence.
We're looking forward to the lockdown ipere and corona obviously ipere because this is an amazing vachokwanisa cross my border which ndo zvinotiramisa isusu kuchikoro as a student ito program practical which notongoda tingoro kuchikoro ikoko saka tongoti zvipere.
Yeah, I think for us how we've really tried to tackle it is to work smarter. You know, how best can we work remotely where possible? It's not always necessary to, you know, to have everybody in at the office.
For others, it's more of a comfort issue.
So I'm just praying and hoping that long-term, business-wise, you know, I grow. And then also long-term, like what they, you know, this whole discussion about achieving herd immunity, that we eventually get there and we'll eventually get rid of these, I mean, enough of them.
The government of Zimbabwe can be commended for aspects of its response to the COVID-19 pandemic. Vaccines were acquired in large numbers before a number of other countries. Borders were quickly shut to minimize cross-border infections, and there were plausible efforts made in raising awareness. However, logistical issues in getting the vaccines to those in need, reversing lagging uptake, and combating disproven theories concerning the vaccines have been major challenges that the government still needs to address if the endeavor is to be deemed a success. For now, vaccinated or not, Zimbabweans eagerly await the return to normal, or as close to it as possible.